Joining me now is State Senator Tom Cullerton from his state Senate offices in Villa Park, Illinois, a veteran of the U.S. Army who chaired Senate hearings into this LaSalle veterans outbreak of COVID-19. Senator, good to have you with us. We want to review sort of what happened here. It was at the hearing that you held where we learned that the hand sanitizer they installed didn't even work to stop COVID-19, didn't stop the spread of it. The staff were attending Halloween parties and going back to work with a very elderly patient population. The state health inspectors didn't even show up for 11 days after the first outbreak began there, and we're already 9 months into this pandemic. What exactly broke down here?
So we're not totally positive exactly everything that broke down. Obviously, the utilization of hand sanitizer that was non-alcohol based is an issue, and I know that Director Chapalavia and her staff have been pushing on making sure that they're up to date on all the CDC recommendations. Sorry if we get a ding here every so often; it may just happen. The other thing is the Halloween party. I can't really speak to. I don't necessarily know what the whole surrounding of that was, but it obviously we would have liked to seen DPH out there a lot sooner. But we're going to get a full investigation into this. We're obviously going to hold a couple more hearings, but we're definitely going to get an outside. The inspector general's coming in and already started an investigation, and we should hopefully get those results within the next month or two. In the meantime, we in the Senate will hold committee hearings. When we first started talking about this at the beginning of the month, myself and Senator Schimpf, who is my counterpart on the Republican side in the Veterans Affairs Committee, the two of us decided to hold a hearing and start talking to the director and to also get DPH, Illinois Department of Public Health, in front of us and chat with them about if they have the full synopsis of what the breakdown was and what we could do going forward to sort of mitigate this so that we don't see it not only in LaSalle, but we can prevent it in other homes. And this is sort of a rough thing that's happened in veteran homes all throughout the country. If you notice some of the stats, Massachusetts, Missouri, New Jersey, they have had some massive outbreaks there as well. So I'm hoping we can get control of it. As of right now, there are 29 deaths at the LaSalle Veterans Home, and it's absolutely heartbreaking to think that this occurred and to think that we need to find a way to stop it from going forward and also have it not occur at any of the other homes that are under our care here in the state of Illinois.
Yeah, it's tragic. 1 in 4 dead, nearly 9 in 10 infected. Yes, congregate living facilities, these closed off places where senior citizens live, are ripe for the rapid spread of COVID-19. We know that, but to this degree, I mean, I don't know that I've seen anywhere that had 9 and 10 people in the building infected.
So it has been seen in other states, and I could probably send you the statistics from other states where it happened in New Jersey, it happened in Massachusetts. I think the big key is that obviously there is some breakdown going on, and we'll see that based on the Inspector General's report. We'll also see it probably and be able to investigate more during hearings. I think one of the biggest factors also is community spread, local spread. We've seen it in nursing homes all over the state that people go out and about in their community, the workers, and then when they come in, they may not know they're symptomatic. They may not, they may have their temperature checked 2-3 times a day. They're wearing a mask, but they're asymptomatic. So they have no idea that they're actually spreading the virus at the time that they're in the home.
One of the other notes was that staff was observed sometimes not wearing masks or not wearing them properly. You'd like to think this was a case of a weary staff letting their guard down, but I'm not sure it was ever up.
I can't speak to that. I would have to definitely, obviously, we want to see what they discuss when they talk to the supervisors at the home, if this was a thing that kept occurring during the summer, or if it was just sort of a lack of, as you said, wearing people down over a course of time. and thinking I'll be good. I haven't caught it yet. That type of scenario. You hope that isn't what happened, and you hope that isn't what occurred. But we'll have to get to the bottom of it while we do these hearings. It's really just such a sad case overall that this even occurred and that we even have to go through these hearings. But it also speaks, I would imagine some of it has to do with airflow in some of these older buildings. As you recall, a few years ago, how bad pipes and uh, water coming in that had been stale through an old water tower uh, created and caused the entire Legionnaires outbreak down in Quincy, Illinois. And part of that is because the facilities are old and we need to upgrade and we need to make sure that the airflow is going through correctly and it's not just circulating COVID throughout the homes.
Yeah, you mentioned that. That was in 2016 in July when the first cases of Legionnaires were caught there at Quincy. There was only about a case or two at the start. The state waited about 6 days to start notifying all the family members that were involved in that first aftermath. When they first learned there was an outbreak, a total of 14 residents would end up dying there. The state would settle that case for north of $6 million, I believe, later after Governor Rauner was gone. That was then, fast forward to 2017, December 2017, almost 2 years ago, almost to the day of when we're having this discussion now. J.B. Pritzker, then a candidate, immediately after this story comes out, starts blasting the incumbent Governor Rauner, saying this was a failure directly to the top. And then a month before the election in 2018 in October, he was still raising this issue. It became central to the campaign. In fact, the third debate was held in Quincy, centered around the promises made to veterans to keep them safe. Here's what then candidate, about to be governor-elect J.B. Pritzker, said at the time. He said, quote, "When 14 veterans and their family members die, when nearly 70 people get sick, when you wait days to tell people on the ground what's going on, you better believe crimes have been committed. This is criminal negligence that cost people their lives." I want to get your response to that. There are some Republicans who look back on the Quincy outbreak and look now. In the Quincy case, Democrats took a year to build their case. It didn't all happen right at the start. But from the start, candidate Pritzker did say this was a failure at the very top. What do you see in this case, and how do you compare? Obviously, Legionnaires and COVID-19 have significant differences, but how much responsibility does Governor Pritzker have in the LaSalle home?
So you asked a lot of questions there. First, I'll start off with how do they compare? Right off the bat, obviously, the Quincy catastrophe, as I told you, started because they had stagnant water in a water tower that sat there for over a month. They opened up the pipes. It came rushing through old pipes that had obviously debris inside of them, and it started to get residents sick. So that was actual. We could find how this actually started.
But it was a mystery at the time. It took them months to actually figure that out.
Well, that was through obviously the investigation and where we went forward. Also, a big difference was we weren't really not informed. If you recall, and you were one of the people who pushed on getting FOIA requests and emails because it seemed like the General Assembly wasn't informed of this at all. And we have been, and I don't want to say we, but the department has obviously put out since day one when the first outbreak happened and any outbreaks that were subsequent all year, what was going on in each and every home. Now, the Inspector General is going to find out and the audit's going to find out where the actual breakdown was. Now, how are we going to be able to find how COVID came in, considering it passes so quickly from person to person and people are asymptomatic, and how we get there. So that's going to be a big piece of the report as well. It's really kind of disturbing on how we're going to get there and what we have to do. And I'm sure through the report, there will be accountability that's held and they'll be able to at least show a point and show a person that we can talk to. I want to say more relevantly, if that's even a word, to drill down where we are. And that's about the best I can give at this point with that. I would say you'd want to talk to the governor if he feels that his comments are on par with what's going on right now. That my deal with running for that, putting those hearings together, they were bipartisan. Again, I still had Senator, and I'm looking like he's here. Sorry, I had Senator Schimpf with me in the committee, and we both agreed to bring forward and make sure to have that conversation with the director of Veterans Affairs, Director Jeffries at the time, and with the director of IDPH, Director Shaw at the time, to go through all.
Another obvious difference in the Quincy outbreak in LaSalle is, of course, that was an isolated incident. This is a pandemic that's impacting the entire globe of COVID-19. But on the other hand, we've had 9 or almost 10 months to prepare for this moment. It is impacting us all, COVID-19. Isn't that more reason to have been better prepared before this outbreak started in early November?
Well, I think we can prepare a lot, but we're also talking about a community which, as we've seen in nursing homes, it's still to this day, once it gets inside of a home, whether it's a private, a public home, whether it's a veteran's home, it's an incredibly vulnerable population. And if you don't know it's there, it moves with incredible speed through an entire population. We've had close to 200 between staff and residents with how fast it moves. And we're not really positive how it came in. And that's going to be the really hard part, even with all of these investigations, is how did it come in, and would there have been a way to stop it actually coming in the facility? But, staff, family members who were visiting the home, they come in and out. You can't just track everybody, and you can't make the staff live there 24 hours a day. So there's obviously, it's susceptible to happen. And it's just a shame.
It's a tragic story there for sure. Zooming out a little bit, looking at how Governor Pritzker has managed the pandemic. Early on, there was the statewide order to stay home in March. Then there was pressure saying, well, some parts of the state aren't seeing as much coronavirus back then, so let's have a regional approach. He broke it into 4 regions of the state and said each of them would graduate through to more lax restrictions. Then it became 11 regions. Then more recently, as coronavirus surged again, he scrapped that regional plan and said, let's go statewide again, let's lock things down. That's a bit hyperbolic to say lock down, but to certainly restrict the flow of business and the flow of traffic through gatherings in public facilities. Now the governor is saying, you know what, even if some regions improve in their COVID-19 metrics, we're still going to keep our statewide orders in place. How do you evaluate that? Given that there are restaurants right now hanging on, trying to survive, and they don't know if they can make it through the winter. Many have already closed. How do you grade how Governor Pritzker has managed this crisis in Illinois?
I think the governor has done well with the crisis. We obviously went through a really tough period in March and April and May that was very difficult. The state was able to drop its levels, and I think he's taking extreme caution right now. As we saw just at the beginning of October, we were at a statewide positivity rate we had dropped down below 4% statewide. And literally in less than 8 weeks, now we're back up to a 12% positivity rate, and we're seeing more than a third of our ICUs, intensive care units, already packed with patients.
And our death rate is among the 5 worst states in the nation.
Yes, and truthfully, Florida just hit over 1 million cases. We're sitting at 700 plus thousand positive rates. I think we could have probably gone quicker to drop out of regions had testing been available, had the federal government helped us with tests, but it is what it is. So we got that up and running as fast as we can. There are pop-up sites all over the state. The state has done a very good job, and the governor has done a good job of making sure that tests are available, tests are out there. We've got 2 different locations here in DuPage County. You can do one right on the east side and one on the west side of DuPage County that are open and available. So that's been incredibly helpful. but obviously it's still moving through us. And I think we all kind of thought, and most people I talked to over the summer said, I wonder when the second wave will hit. And we can pretty much assume that end of October, beginning of November is when second wave hit. And how long are we going to struggle through December with it? And did people stay away for Thanksgiving? Did they go to large family gatherings? Are we going to see that sweep through? So I think the governor's taking extreme caution so that we don't have another big outbreak in December, nor do we have a large outbreak going into Christmas.
I do want to get your input on this. One of the big conversations the legislature was preparing to have in person before they were sidelined in March and scattered to go back across the state was about ethics in government. At the time, Governor Pritzker said that anybody who was under indictment should resign. You disagreed with that. Why?
So obviously, I can't really talk too much about what's going on with my stuff as it's all pending.
But on the issue of remaining in public office while under indictment, can you speak to that?
I probably shouldn't speak to that per what my lawyer had said with pending litigation.
Okay, and I understand. I was informed that you couldn't speak about your case. The feds brought an indictment. You've pleaded not guilty to this issue. Can you evaluate what's happening in the House with Speaker Madigan? Because the feds are bringing cases against, in fact, just this week, 4 of his inner circle were named and indicted, and they entered pleas of not guilty as well in this ComEd corruption case. One of the central charges there was that interns or people were given jobs or given favors to be on the payroll without doing much for it. That seems to be a habit, or at least the feds are making that case, that people connected in politics would land on a payroll there. How do you evaluate that, and what do you think of a culture that allowed that to happen?
So, as I've watched, obviously everybody else has watched what's going on with the ComEd case. Obviously, not all the facts are out. Not everything has come out yet. And realistically, it's a lot of speculation. So I'm assuming that we'll learn more as the case goes on, and we'll learn more as the House does their, similar to what we're doing in the veterans organization, and the House does their investigation as well. That's being led by Representative.
Are there any specific, let me ask this first. You're in the middle of a 4-year term. That term expires in 2022. Do you intend right now to run for re-election?
I'm not really sure why I would. You know what? I haven't even made that decision. Literally, the election for president just ended 4 weeks ago. So obviously, we haven't even been sworn in yet, and we'll see how things go. Plus, there's going to be a new map drawn. So every district could be a lot different. And we'll see what happens in probably the next 9-10 months when petitions start next September.
I do wonder about your perspective, given what the last year or two has been like for you, watching the public discussion. You're a central figure in some of it. Much of that has sort of, I don't want to say blown over, but it has not been at the center of attention while this ComEd case has taken the forefront. So you do have a unique perspective here. Are there any ethical fixes? Are there any immediate steps that you would say, you know what, we should definitely do this to clean up the perception or the reality of corruption in government?
So I think a big factor is obviously the Joint Commission on ethics reform that's led by Leader Harris, and then over in our chamber by Senator Castro, and Senator Sims is going to have a lot to say about that. They're going to push forward with obviously some different things that have to do with lobbying, expenses, the way fundraising can be done. So I believe you'll see some of those come out. And I don't think you'll find much pushback on any of that from anyone. And they'll probably be pretty easy to go. It's just a matter of hopefully at the beginning of lame duck session, one of the first things the House will do is possibly make a vote to allow virtual hearings so that we can do more of this stuff for committee hearings out in the light, and we can make sure that the House can meet, just like the Senate has been holding hearings through the summer on equity, on transportation, on labor issues, especially a lot of things that are very important to the Black Caucus and very important to the Democrat caucus in the Senate. We've been privileged to be able to hold those committee hearings, whereas the House has been unable to.
I want to thank you for coming on with us. I know this issue itself of the Veterans Home and the work of the legislature and COVID-19 and the ethics are all very important, pressing matters, and I appreciate you having this conversation with us, even during this perhaps uncomfortable time for you. I noticed that you haven't been as vocal in the press during a lot of this time, and so I want to ask if you can. I respect that what you said. Your lawyer said you can't speak to the case itself, but can you speak to your voters? Can you speak to people in your district? Is there something that you've wanted to tell them about you? We understand you hope to clear your name through this legal process, and so I'm not asking you to try your case or defend yourself necessarily in the court of public opinion here, but I do wonder, is there something that you would have liked to have said along this process as you push to clear your name? Can you even do that once the charges have been brought? A politician, really, their main currency is their reputation here. What kind of a challenge is that for you in moving forward in public life? And what do you hope voters know about the person that is Senator Tom Cullerton?
During the pandemic, obviously, you haven't seen a lot of people be very vocal in the press, and we maintain constant contact with the people of the 23rd Senate District. When the pandemic hit, I was out there and we dropped off 1,500 gallons of disinfectant that a local constituent here in the 23rd District donated. We dropped to all the police stations, the firehouses, and the Public Works Department as they were trying to find just disinfectant to wipe down vehicles, wipe down offices, and wipe down countertops. We were able to do that. So we are continuing, and I have continued just like I have even before any of this, to make sure that service here in the 23rd and getting sure that constituents are taken care of is our number one priority. Obviously, with the pandemic the way it is, it's been very disheartening, but we were right at the forefront at the beginning trying to help people with their unemployment checks. We made sure that every local business, local chamber knows about all the different opportunities for PPP, the payment protection. We also have made sure that everybody knows how to get grants through the state, through the Small Business Association grants. So obviously through this entire process, we still are being incredibly forthright and making sure that our constituents are taken care of.
All right, well, Senator Cullerton, thank you for joining us. I do appreciate that, and we'll stay tuned to see what happens next in these Senate investigative hearings into what happened in LaSalle. As you look at that, how should the public expect to see, you mentioned the bipartisan nature of this. Obviously, people expect Democrats to go a little harder on Republicans, Republicans to be a little harder on Democrats for the political purposes, but how do you plan to manage that, knowing that Governor Pritzker and this administration are Democrats? You're a Democrat. Do you plan to hold their feet to the fire with the same level of intensity and scrutiny as you did Governor Rauner?
Of course, and I did. And if you saw from those hearings, obviously, and I never, in those hearings, I actually look back on it. I've heard people out there screaming, who's going to get fired? What's going on here? We never called for that, or I never personally called for that with Director Jeffries or Director Shaw. I wanted the governor to hold his team accountable, and I assume that our governor will do the same. Now, other people on that committee got a little fire and brimstone, and I think it was both sides. We had Republicans and Democrats who were getting hot under the collar, and that's fine. And as chair of the committee, I can do my best just to keep things civil and make sure it doesn't get to name calling, finger pointing, but actual questions and get to the answers.
All right, well, Senator, thank you for joining us, and we hope to stay in touch and see where this goes from here.
All right, thank you, Mark. Appreciate it.
When we come back, Congressman Adam Kinzinger. That's next.